If you're over 65 and your doctor told you not to bother with cancer screening tests because you have a limited life expectancy due to your age, would you be relieved not to have a pap smear for uterine cancer or a PSA for prostate cancer or a mammogram or a colonoscopy? Or would you feel slighted?
I think it would depend on how the doctor presented it. It's like you're an old geezer, we're not going to bother with you and we're not going to spend money on you. Yeah, I'd be a little put out. But if the real situation was that all these cancers take a long time to develop, and say you're 75 or 80 years old, you're probably going to die from something else first, right? Before you got the cancer.
Well, studies show that cancer screening can be overdone in the elderly, especially, and for a variety of reasons. Now, remember what happened with mammograms a few years ago?
Oh, yeah. The United States Preventive Services Task Force came out with a statement that's saying that for women under the age of 50 that they couldn't really recommend it, and they left it up to their doctor to make the decision. But that was their way of saying that they didn't think the test was necessary. But what women interpreted, a lot of them, particularly the women's rights people, was you're taking this test away from us because you don't want to spend the money on it. And you don't want to spend the money on it at our expense. But as it turns out, the U.S. Preventive Services Task Force knew exactly what they're talking about. And now we're questioning, actually, in some circles, the use of mammograms at all.
So now the studies are showing that there can be a higher risk of complications, especially in the elderly, than benefit.
Well, you'd expect that.
Especially with colonoscopies.
Sure, because, I mean, basically you have to do 200 colonoscopies to find one important thing that might save a life or diagnose a cancer or something like that. But at the same time, 1 in 200 is going to have a perforation and a GI bleed that's going to lead to being in the hospital.
So that's kind of a wash.
Well, it's sort of a wash because you don't usually die from that, but people have. So you have to think twice about it. And what about if you're a very fit person and your vitamin D levels are high? What's your risk of getting cancer in that setting? It's more like 1 in 500. Now the tables are turned. So we have to look at these screening tests as to be done only in certain people, in certain population groups, not across the board.
I think a lot of people get confused about screenings and they classify that as prevention.
Mm-hmm.
And
big difference.
It's really not prevention. It's early detection, and there's a difference. I mean, it's nice to detect something early if you think you can do something, to prevent it.
But you can look at it another way too. If you find too many early cancers, a lot of those early cancers do what?
Go away on their own.
They disappear on their own. Maybe as many as 20 or 30% of them, depending on what they are, particularly with the lung and with the breast, especially the ductal carcinoma and situ breast cancers. So there's a plus and a minus on it. And it's easy to see why doctors would be aggressive and want to do everything they can to try and diagnose what's happening early so you have a better chance at cure. But if you're over-treating cancers that don't need to be treated with treatments like surgery, chemotherapy, and radiation, there's a downside to this, plus all the mental stuff, the emotional stuff that goes with the worry.
Well, the official guidelines are to get these tests done every 10 years after 55.
Well, the colonoscopy.
After 55.
Mm-hmm.
So 55, 65, and then after 75, you don't need to do it anymore.
That's right. Well, you have to look at some other issues too. I mean, why do so many doctors recommend doing a colonoscopy? Is it because it's their business? Is there a conflict of interest there? I notice that a lot of almost every gastroenterologist sends out reminders to their patients to have these tests done. Is it because they're really diligent and don't want them to get cancer? I'd say absolutely that's part of it. But there's also an unconscious part of it that has to do with economics. So the conflict of interest is something that we should be concerned with. And then there's also the issue of malpractice. I mean, if you don't do that test every 10 years as is recommended and somebody gets a colon cancer, you've got a problem.
So then the doctor feels responsible. The other thing is, too, is that there are all these walks, for cancer. And they make it seem like screenings are a cure. They're like, we're going to do a walk for the cure or a run for the cure or whatever it is. And the cancer screening is what they promote. They talk about that when they're talking about the cure. But the screening's not a cure. Lifestyle and prevention and wellness, all those things are what we should be focusing on instead of after the cat is out of the bag and then trying to get rid of it.
And who's promoting that? Not much at all in terms of effort. We know that prevention is important. We know what to do to prevent these cancers. And yet we don't really focus on it in the mainstream of medicine because we focus on a disease care system rather than a health care system where we're trying to keep people healthy by diet, exercise, stress, sleep, weight, exposure to toxic chemicals, and finding joy in life.
And when you say toxic chemicals, look at what we're doing to our environment. We need to start cleaning up our air and our water and our food.
And our soil.
All of it.
That's right. So if you're over age 65, maybe you don't need to do as many screening tests. But if we're really going to think about the best way to solve this problem, it's not going to be just with screening tests. It's going to be doing the hard work of taking the responsibility of making sure that our lifestyles are lived in a healthy way.